breakout session, Navigating Cleft Care as an Adult, featuring myself and Ellie Mador. Please come on up. And just a little note, this will be a little bit different from everything you've seen thus far today. We're going to have a conversation about our Cleft Care, and we hope that you are able to walk away feeling empowered and, like Ellie said earlier, have the autonomy and the just the ability to take control of your care at that 18 plus stage, because it's difficult, and we hope to just give you a couple of tidbits and takeaways. So without further ado, here we go. Once again, my name's Toni-Elizabeth. I was born in Chicago, Illinois, and I've had 25 plus surgeries to address multiple different congenital anomalies, most prevalent being a bilateral cleft lip and palate complete, as well as a club foot, middle ear problems, pretty much anything that you could associate with the cleft lip and palate or congenital anomaly, I had it. So I had most of my work up until age 18 at the wonderful Rush University Medical Center in Chicago, Illinois, under the care of Dr. John W. Pauly and Dr. Alvaro Figueroa. They actually started a craniofacial center, and I was one of their very first patients. And I feel so blessed to have been under their care for 18 years of my life. So speaking about adulthood, from the age of 18 to now 32, I've had about 5 different surgeries, but we will get into that. I want to hand it over to Ellie.
Hi, everybody. You probably just heard me talk, but I'll introduce myself again. My name is Ellie Mador. Can you cue the next slide? Yes. Oh, thank you. And I was born in 1994, best year ever. I had 10 surgeries by the age of 18 at 2 different hospitals. I was born in Connecticut. Initially, my care was done at Yale New Haven Hospital, which wasn't my parents' choice, but they had an HMO insurance plan, so they were not able to choose to go to the best hospital that they thought would provide the best care. So Yale didn't have a team model at the time. It was really just like one plastic surgeon. And my parents were unhappy with my initial cleft lip palate result. And my dad actually at a wedding saw a kid that had a cleft, and someone pointed it out to him, and he was like, and my dad has a cleft, and my dad was like, he doesn't have a cleft. And they were like, yeah, he does. And my dad was like, well, where do they go to get treatment? Because clearly they're doing a really good job. And it was NYU. So we moved my treatment out forward to NYU. And I traveled from Eastern Connecticut 3 hours to NYU every 6 weeks, beginning at age 4 until 18 for monthly orthodontic and ENT care. So it was a big part of my life. Next slide.
Okay. So I guess just getting into it, Ellie,
Yeah.
I know we have that shared bond of surgery in 2024. For context,
Yeah.
you had your surgery in?
It was in President's Day, so February of this year.
Okay, and then I had a surgery in April. Would you mind telling the audience what exactly you had done?
Yeah, sure. So I think it was maybe my 18th surgery, like for my cleft specifically, but I had a revision rhinoplasty. So I had a rhinoplasty when I was 18. And so this was a revision rhinoplasty kind of back to my initial cleft surgery, the way that the surgeon did it, like I ended up having a really narrow nostril, and my NYU team really tried to do whatever they could to make it bigger, but they could only do so much. And that's why I think it's really important. Like that first surgery does really determine a lot of your treatment and what treatment you'll need when it comes to fistula as well. Yeah. I know we both have fistulas, so it is really important. And so I have had breathing issues on my cleft affected side my whole life, and I just kind of got used to it. But then I was like, COVID and masks, and I realized I literally can't breathe. And I also didn't love how it looked. And so I just really decided in my late 20s that I was finally gonna do it and I wanted to find the best of the best. I was like, I have gone through so many traumatic surgeries in my life with doctors that I didn't feel like had my best interests at heart. And I just was like, if I'm gonna do this, I'm gonna do it the right way. And I don't care if I have to pay a bunch of money. I don't care if I have to travel.
Wait list, you didn't care.
Yeah, so that was what brought me to get my surgery in February. What about you?
Similar to you, I also had a revision. I had cleft rhinoplasty and septoplasty. That top left photo is probably like a week after the surgery. And for me, I had this surgery back in 2017, but as I think we all know, it unfortunately failed. The graft that was set up didn't hold. And so when I look back at pictures from that time period, I can see 9 months post-op that the surgery started, the skin started contracting. And so then my nose kind of went back to its pre-2017 shape. And if we're totally honest, because this is a safe space, it was really more about aesthetics for me when I decided to have this most recent surgery. I knew that I wanted more symmetry and whatever that looked like. And I, again, like you, I had to put kind of my trust into a new team because my doctor had moved from Chicago, and at this point in my life, I had 2 children, a husband, a house, a family, work obligations, and it was not feasible for me to leave Baltimore, Maryland, travel to Traverse City, Michigan, where my old surgeon was, and then have this massively invasive surgery, recover. It just logistically didn't make sense for me. And so the last bullet, I actually found my new Cleft Care team through Smile Train, through CleftCon last year. And I contacted them. There was a wait list, but I was like, no, if it's meant to be, the stars will, align. And they did, and I was able to go to my very first cleft clinic. I had never seen anything
I remember
like that.
You texting me when you did that, and so we were kind of going through our consultations at the same time, and we had just become quick, fast friends, and it was really good to it was really helpful to have someone who knew what was going on because you've been through it yourself as an adult navigating that, because I think especially when you're an adult and going through cleft treatment, you can maybe feel alone because all the decision rests on you. Really, you are the responsible one. You are responsible for paying for it, for figuring out the logistics, and it's a lot. And I think, understandably, that's why a lot of people avoid doing it.
There was a large period in my 20s where I lived outside of Chicago. I was in Missouri, and I was like, I'm definitely not going to seek care here. I don't even think they know what a cleft is here in the middle of nowhere. So I just was like, no, I'm not doing it. And I didn't. There were no follow-up appointments. There were no consultations. It was just I'm going to, live life for a little bit.
Could you click?
Yes.
I just want to. Oh yeah. Yeah. So I think for me, like on that vein, I had a really negative experience in my early 20s because I had to find a new surgeon, and I had a surgery, and I kind of felt like a guinea pig. Like it was terrible. Like it was really bad. And I was 22, and I like I felt a lot of shame. I felt like I couldn't tell anyone that it had happened because it was my fault. I had anxiety. Like I just lost a lot of trust, and so I avoided Kayla, like you said. And I think that like one thing for me is that in your 20s, you have a lot going on. You're newly an adult, and like it's okay to wait to get Kayla until you're mentally able to. And that's something that like I've really noticed now that I'm 30 is that my brain is definitely different. Like I'm able to make decisions in a more informed way.
So that brings me to like, what would you, I guess, do differently from that point in your life to now, or what did you do differently when you had this new surgeon?
Well, what I did differently is that I was really intentional in who would be my support person. So the photo on the bottom right is my sister in the back. And that was just like driving back from the hospital after my rhinoplasty. And she went to my consultations with me and like took notes, and it was just like totally different experience because both my parents, they're divorced. They have their own like guilt or whatever, like baggage around my medical care that makes sometimes it different, like having them come to consultations as an adult. And my sister just like had a very level-headed, like,
and that's important.
Yeah, so she was really crucial to like the success of me picking a surgeon that is amazing. And my surgeon I picked spent 2 hours with me in my consultation.
That's unheard of.
Yeah, I mean, it was expensive. Like, in my opinion, it was worth it. But yeah, so I just like, I did a bunch of consultations and then I picked the best one. Like I literally vetted them and interviewed them. And I think a lot of people, it is a lot of energy. It takes a lot of energy, but it will pay off to do it that way.
Yeah. And in that same breath, I think it's important for us as cleft-affected adults to remember that when we are going to these consultations, it's like an interview. Like your provider, you're paying them, so you're hiring them to do a surgery, right? So like, don't be afraid to ask all of the hard questions. Don't feel like, oh, I don't want to be the difficult patient. No, I think you owe it to yourself to be the difficult patient.
And if they call you difficult,
leave.
Because a doctor did say, like, why I asked him for photos of like similar cases to mine, because you're going to be operating on my body. Like, I want to know
that you can do it.
Yeah, that you're good. And there's a lot of choices out there. And he was like, wow, you're really asking a lot of me. I do not like him. Yeah, like very arrogant. And so in the past, maybe I would have been like, oh, like you're the expert, like, okay, whatever. And then scheduled a surgery with him. And no, like, don't. Follow your gut.
And I think after 10 plus surgeries, 20 plus years, like, I feel qualified enough to be called an expert, especially when it comes to like your own personal care. And these surgeries they're not cheap. They're extremely expensive, and like you just said, sometimes they're not even covered. So you have to do your due diligence and vetting the surgeon and asking the questions. And there's a lot of medical jargon, and I think a lot of times doctors have the tendency to talk at you instead of talking to you. And it's like, slow down. I didn't go to medical school. Like, sound it out. Take your time. Give it to me in layman's terms. And I think that's okay to kind of set that expectation. So let me ask you, Ellie. With regards to your most recent surgery, how was that recovery?
It's been good. I feel like it was a success. I mean, like, obviously, you never know how it's going to turn out because the way the body heals. But I definitely feel I can breathe, so that's good. I can breathe on this side, which like I literally never have been able to do. So it's kind of wild. And I feel like I'm a little more confident. I also got fat injections, like very subtle fat injections in my cheeks, which like probably no one can notice, but I feel like I noticed them. And yeah, I'm so happy. And again, like I just love my doctor so much. And like that feeling is, I just feel like he has my best interests at heart, and like I feel like I can be completely honest with him.
Yeah.
So yeah.
And that's, I think, sometimes hard to do because I can't count the number of doctors in my lifetime where I wasn't maybe totally honest. And so my new surgeon, he's 37, like maybe fresh out of med school. But when I was talking to him and expressing my fears, he's like, oh no, like we're gonna do things differently. I'm gonna build up underneath the graft because I had this internal fear that like, man, this surgery is gonna fail again and I cannot go through another rib graft like that.
Yeah.
I've had 2 children and the rib graft is the one that almost took me out.
Oh my God, yeah.
And just telling him that, he was so reassuring, and I think that's really something special to have because when you're a child, they're not talking to you. They're talking to your parents, like I said, they're talking around you, above you, in circles. And then finally having, when you're an adult and it's kind of put into your lap, you're like, okay, like it's a learning disadvantage, in my opinion.
Right.
And so having someone who was like, hey, this is what we're gonna do. Don't worry about the insurance aspect. We're gonna get it covered, because I think everybody here can speak to like trauma in that regard of having like surgeries canceled. I know I can. I'm still terrified and traumatized about it. You know, having a surgery canceled 8 hours before you're supposed to report to the OR, and then the surgeon who you really don't have the best rapport with because you don't know him, he says, well, if you have $40,000, we can do it. And I'm like, well, no, I don't. Like, I have college loan debt. Can we trade?
Yeah.
So I just, like, I'm so grateful for Smile Train for kind of bridging that gap. I say that all the time, and I say it because I mean it, and just putting Dr. Nellis in my life and just having someone who was like, okay, we're going to go about it a different way. I know you've had this surgery before, but here's what I'm going to do differently, and we're going to hope that it works. And I just respect him for not talking in percentages, like, oh, there's a 50% chance.
Yeah, I think it makes me think a lot about, like, both of our experiences this past time, which I think were positive. Like, it makes me think a lot about the presentation earlier from the surgeon at Texas Children's, and just like patient-centered care and communicating and saying like, what questions do you have? Not, do you have any questions? But actually like saying you should have questions from the doctor. And like, so I'm really happy that we both seemed to like, it might have taken a while, but like find doctors that we liked and that advocate for us. And I know like with you and your lip fillers, like you were able to get that covered
under insurance. I was the first
and
patient.
they did it and they knew what codes to use, and like it's just it's unfortunately not every doctor and care team like will be the same in quality wise, and so you do need to do your research and like talk and consult, but they're out there. Like there's really good teams out there, and I think we've seen some of them today. And so
Okay, so before we take questions, what's one thing that you would say to the people in this room who are maybe thinking about having another surgery in their adult years?
Can you go to
Absolutely.
the other one?
Oh.
Sorry. Yeah. I think for me, it's the third bullet. It's informed and collaborative decision making. This is Toni and me. When we got dinner and we're becoming friends, and then we went to the Smile Chain Gala. But yeah, informed and collaborative decision making. I think if you're consulting with a doctor that isn't willing to like be collaborative with you and isn't allowing you to like ask questions, then it's not the right provider.
Yeah, and that's okay.
Yeah.
I think it's okay. You don't ever have to go with the first provider you see. Like,
No, and I think you feel pressure too because
Yes.
you're just like, oh, you can fix this, like, but it's not a good idea. And one thing with my doctor is he was like, take time, like take time to think about it. And I was like, whoa, like that he's like telling me I can take time.
Yeah.
So, what about you?
For me, I would just say, just going back to my previous experience with having a surgeon that really didn't have a cleft specialty, and then after he did one cleft palate repair for me, he suddenly had a cleft specialty. I think it's really a matter of doing your due diligence and not leaping at the first person that says, hey, I can do this, I can do that,
Yeah.
because it's really at this stage in my life, it's about show me you can do it. Don't show me, like, let me see the proof that you can do it. You know, make them back up their words, and there's nothing wrong with that.
And rely on your support, which I know you have like a very
Yeah.
supportive husband, and your mom is really supportive,
Yes.
and I have family, and like really involve them in the decision making too, because they can help you feel less
and
alone.
my mom's been on this journey with me for 32 years, and she has never missed a surgery. Even this last one, she's like, I'm on my way, I'll take care of the kids, you got it. And I'm like, thank you so much. And I think it's just, you don't realize how important the people that are in your village are until you really you need them. And when I realized I wasn't gonna bounce back from that surgery like I had made up in my mind, I was like, oh my God, I need my mom. And she's like, cancel my flight, I'll stay a little bit longer. So I'm pure gratitude.
Yeah.
I want to thank our two speakers. This was wonderful. Thank you for sharing so much of your stories with us.